What if I told you that one of the most powerful tools in public health isn't a new drug or some fancy medical device? Nope, it's the map. And today we're going to see how data transforms a simple map into a tool that can literally save lives. All right, to really get this, let's put you in the hot seat. Imagine you're in charge of public health for a city. And you're not just on the clock, you're in a race against time. So picture this, a mysterious illness pops up out of nowhere. It's spreading, and it's spreading fast. You're getting flooded with data, just numbers and reports, and it all feels like total chaos. Everyone's looking at you. So how on earth do you find the pattern in all that noise?
I mean, just look at this curve. Day 1, you've got 50 cases. By day 5, it's 800. This is an exponential nightmare. The numbers are screaming that you have a massive problem, but they're giving you absolutely zero clues about why it's happening.
So, to get to the why, you've got to start asking a totally different kind of question. It's not just about the numbers anymore, it's about location. And this, my friends, brings us to the incredible power of where.
You know, your first instinct might be to look at the what. What is this virus? Or maybe the who. Who's getting sick? And yeah, that's all super important stuff, don't get me wrong. But it's only one piece of the puzzle. The real breakthrough, well, it came from looking at the problem in a whole new way.
The breakthrough was hiding in plain sight. It was all about the where. The second you stop looking at a spreadsheet and start plotting those cases on a map, a whole new dimension of the problem just appears. And that's the key we're talking about today.
Okay, so this whole idea has a name: geospatial analysis. And don't let the fancy term fool you. At its heart, it's basically the science of telling stories with maps. It's about taking location, which we usually think of as just a backdrop, and making it a lead character in the story the data is trying to tell us.
All right, so how do they actually do this? How do you go from a list of sick people to a map that points to the solution? Let's pop the hood and decode the process.
So, it all starts with something called geocoding. That's just a technical way of saying you turn a street address into a tiny, precise dot on a map. Simple enough. Then, you've got buffering. Think of it like drawing a circle around those dots to see what else is nearby. But then, and this is where the real magic happens, you use overlay. You start stacking different maps on top of each other. The map of sick people, a map of water pipes, a map of bus stops, and you look for where they all intersect.
And that's just the start. The toolkit gets even deeper. You have something called network analysis, which helps figure out the absolute fastest routes for ambulances or supply trucks. And then there's raster processing, where you can layer in stuff like satellite images to see if, say, a cluster of asthma cases lines up perfectly with the pollution from a nearby factory.
So what kind of gear are these data detectives using? Well, they're using really powerful mapping software like ArcGIS and QGIS. For more custom jobs, they'll use data science tools like GeoPandas. And for ridiculously high-detailed maps, they can use something called LiDAR, which shoots out lasers to build these incredibly precise 3D models of the world. Pretty cool, right?
But here's the thing, this is so much bigger than just tracking a single outbreak. This way of thinking, geospatial analysis, is like a superpower for looking at the entire health of a community. It can reveal everything from where the next hotspot might be to these really deep-seated problems with health equity.
I mean, the payoff here is massive. You can spot disease clusters before they totally blow up. You can literally see with crystal clarity why one neighborhood has different health outcomes than the one right next to it. And this lets us get so much smarter with our resources, right? You can put a mobile testing site exactly where it's needed most, not just where it's easy. It's about making smart, data-driven decisions that actually help people. Take a look at this. It's a perfect example. A quick map analysis can show you that, wow, a full third of the people in this city can't even get to a clinic in 15 minutes. Think about that. That one insight, revealed by a map, can completely change public policy and get new clinics built where they need to be. And this is where it gets really powerful. Check this out. On one side, you have a neighborhood with high asthma rates, and, it's also right next to a major pollution source and has almost no parks. On the other side, the exact opposite. What the map does is it shows you that these aren't separate problems. They're all connected, all happening in the exact same place. It proves that sometimes your zip code can be more important than your genetic code. So what's next? Where is all of this heading? Well, honestly, we're just scratching the surface of what the maps of tomorrow are going to be able to do. And really, it all boils down to this one really powerful idea. If we can truly understand the where, we unlock the how. How we can respond faster, how we can share resources more fairly, and ultimately, how we can build a world that's healthier and more just for everybody. And that's the big question I want to leave you with.
We've seen how a map can help stop a disease and shine a light on inequality. So just imagine, what other huge challenges, we're talking climate change, food shortages, you name it, could we start to solve if we just began by asking where?
Hey, if this explainer helped you see maps in a new light, do me a favor and hit that like button. Drop a comment with your thoughts, and definitely subscribe so you don't miss what we break down next.
And hey, if you're more of a listener, you can find the audio version of this on Apple Podcasts. The link is right down there in the description for you.
We really do want to hear from you. What's another complex topic you think we should try to map out? Let us know in the comments. Thanks for watching.